Welcome to Bear in Mind, the Brown Psychiatry Podcast, clear, current content about mental health.
Here's the second part of our episode.
Yeah, I wanted to clarify that because I think some people may think that the route that they take it, how they take it, makes a difference. If they take a gummy, it may seem less potent than if they vape it, or if they smoke it, or if they have a cookie or any other type of edible. And so let's talk about that. Is that true? Is it clear that the potency of THC is higher across the board in no matter which way you ingest or smoke the cannabis?
It can be higher smoking, and for two reasons. One is that getting it into the body quicker, and also the difference between not being high and suddenly being very high produces a feeling people will sometimes call a rush.
Right.
And that's highly pleasurable, that change in sensation. The other thing is that some of the cannabinoids in cannabis are activated by heat and converted to THC by the heat process. So that vaping or smoking causes more of that to occur.
And we know that some states have legalized cannabis. So I'm wondering, how has it affected the prevalence of cannabis use disorder?
Up. So in the 1960s, 70s, 80s, maybe I think 9% of people were, young people were using cannabis or something, had used it, had tried it. Most recent data suggests 47% of people have tried cannabis before they get out of college, and it's much more prevalent. And the numbers of people who are dependent, who have cannabis use disorder, likewise have increased. People who use it every day, and that's concern. If one finds themselves using cannabis every day, that's an issue because it lasts a long time, and so essentially a person's high, essentially the whole day or much of the day, and that can lead to a cannabis use disorder. The prevalence is also the fact that it is legal. In part, there's a resistance to, if it's hard to get drugs, people won't get them. There's studies that say the number of people with alcohol use disorder depends on the number of places you could buy alcohol in the neighborhood. If alcohol is more easily available, people drink it.
Makes sense.
And so if cannabis is freely available everywhere, and more people will try it, it becomes socially acceptable, and we can see that half of youth have tried cannabis. A proportion are using it every day, and that can cause impairment.
So let's drill down a little bit more on a couple of things to make sure everyone is on the same page about what we're talking about. We've been talking about cannabis, but what are some of the other names that cannabis goes by so people know what we're talking about when we mention cannabis?
Okay. There are a number of names. So cannabis, marijuana, hemp. There are sometimes people will talk about the chemical names THC because you can get the pure chemical, Delta 9, Delta 8. The stores will have the dispensaries will have names. Summer's Night or something. Kind of that people might pick up. They're words, the hooch. There's also just to know that there are there are forms of marijuana that are synthetic, sometimes called K2 or spice, and these are particularly potent and can actually cause psychosis in somebody who doesn't have psychosis or has doesn't even have the history of it or family history.
And are those the more illicit types of marijuana?
Yes,
Because now you can sort of, when we talk about cannabis, weed, or marijuana, there are dispensaries that give that sell those things in a variety of different forms. But when we're talking about illicit substances, we want to try to be clear that that's not what's being sold, K2 or spice, in a dispensary.
Yeah.
But you can certainly still buy cannabis off the street.
Well, and that's a concern because cannabis I know of instances in which cannabis was laced with fentanyl.
Yeah.
People overdosed. So the illicit drug dealers, have a batch of fentanyl and they process it, and then they go and do some cannabis and process it, and the fentanyl mixes with the cannabis, and they don't care.
Right.
And there's, things there. A lot of fentanyl is actually laced now with an animal tranquilizer called xylazine.
Right.
About 30% of the opiates sold illicitly in Rhode Island have this xylazine in there. And I wouldn't be surprised if the cannabis on the street has that as well. So anybody using street drugs should have naloxone or Narcan, which is available through drugstores. It's free. You get it at fire stations, police stations. You can get it from your doctor. It's an antidote because you never know when the substance you're using, particularly, even if someone said they bought it at a dispensary, maybe they didn't.
Right.
And, you need to kind of protect yourself or protect your friends.
Right.
Or your family, and have some of this Narcan available because it could save a life.
Right. It's very easy to use. You can there are very good instructional videos.
Yeah. It comes in a little plastic tube, and you just spray it.
It's a nasal spray.
Nasal spray.
Yeah. It's very easy to use. It's not complicated. It's really something a layperson can do, and so very important to have Narcan available and free. Here in Rhode Island for people to access very easily.
And even if you're not using, a person says, well, I never use opiates. I just use marijuana.
Right.
You might still be using opiates and not know about it because of the contamination.
Absolutely.
And you mentioned one of the potential consequences of using cannabis, particularly THC, is the anxiety that it can cause. Can you comment a little bit more about that? How does it affect who is using?
Well, it as I said, it can stimulate parts of the brain that cause paranoia and psychosis and the concern. People may feel, as part of. So drugs cause different effects, and at low doses, a drug may cause a certain effect, may cause some relaxation. But when you get to those higher doses, because you get tolerant and you use more than you intended, you can then get a lot more serious effects like the anxiety. And the anxiety is greater at higher doses. Another example with cannabis, marijuana, is at very low doses, marijuana is an anti-nausea medication. We call it an anti-emetic. But people who use high doses and a lot of marijuana develop a uncontrollable nausea and vomiting.
Right.
And every emergency room doctor in the state is familiar with this because people come in all the time with just uncontrollable nausea and vomiting, and it's from cannabis, it's from marijuana, and usually high doses of it. So low doses can have a more mild effect. Higher doses, a more dramatic and sometimes deleterious effect.
What are low doses? Because I know that people have very different views about this. So what would you say would be a low dose? Are you talking about the doses in the marijuana of the past, of the 2%?
Yeah, the doses in the marijuana of the past, or or not using a lot.
Yeah.
You know, just using very small amounts if the medication is potent. But there are people who are vaping all day,
Right.
or smoking big blunts, you know, kind of cigar-shaped marijuana cigarettes. And, you know, there's a lot of cannabis in a vaping vial. And people are just puffing and not really sometimes realizing how much of the substance they're getting. Same thing with smoking, with tobacco, with vaping tobacco.
Right.
Nicotine can also instill very high doses of nicotine in the body, because you just sit there, it tastes good, it feels good.
Right.
You know, there's not a negative effect of it. Even medical marijuana, there's no dose.
Right.
We legalized marijuana, and we don't have a good way of measuring dosage. You know, alcohol's better, because at least you could, you know how much alcohol is in it. It says so on the label. You know, so one can calculate how many grams of alcohol a person is consuming.
Right.
But you can't know how much.
Well, this is my point about low.
Principle. Yeah.
This is, because I think that people in the community say, well, I don't use that much. And certainly in your example of vaping, you may not be aware of how much you're vaping. But there are people out there who say, well, I have a gummy 3 times a week, 4 times a week. But what's in the gummy? How much is in the gummy? And then you go a week without that, and then you don't feel quite right. You don't feel well. And, well, I'm only taking a little. I can't be in withdrawal. There's nothing wrong with me, but other people may notice you're more anxious, you're distressed, you're irritable, you're agitated, you're not sleeping as well. And so I think that's a very important point, that we don't know what low versus high is, because there isn't a standard.
Right.
And people are inserting what low means. But
That's
there
a
is
good
no
point.
evidence to suggest what that is, because there's no standard.
And even in the dispensaries,
Yeah.
the National Institute of Drug Abuse has done studies of going around and buying up medical marijuana and finding that the dosage was different than what's on the label.
Right.
The cannabinoids in there. So many people will just say CBD is legal because it doesn't make you high. It's not a controlled substance, whereas THC is illegal or controlled substance. And so they've National Institute of Drug Abuse and other folks have analyzed CBD and found that it has THC in it.
Right.
And so you can't, even when you're getting what you think might be a good source,
Right.
you don't know,
don't
because
know.
it's not a product that's regulated by the Food and Drug Administration.
I think that's a very important point for people to really know, that just because there's a storefront, it doesn't indicate that there is a vetting process associated with that has a standardization. So I think that's very important for people to know for their safety.
Yes.
To shift gears a little bit, we've been focusing a lot on sort of individuals, but I'm wondering, how does addiction affect families?
Addiction can have very profound effects on families in several ways. First of all, the individual who is using the substances is often unavailable to the family. They may think they're fine, but they're stoned at night or something and just not available. And that can cause problems of neglect for children. The use of certain substances, for example, alcohol, can increase anger and cause disinhibition. So people get angry and abusive, and many people in families in which a parent was one or both parents were alcoholic will tell you about the physical and emotional abuse that they experienced growing up because of the effects of the drug. And then there's the financial aspect of it, that money that could be used for the benefit of the family, for nutrition, for family activities, for have a good housing, things like that, are spent on the substance, which is very expensive. And even things like cigarettes, remember nicotine is one of those substances that causes substance use disorder. What are cigarettes a pack now? They're like $20.
Almost $20 a pack.
Yeah. And somebody smoking 2 packs a day, that's a lot of money that's going to the tobacco industry that could be going to a person's family.
Right. One of the other things that really seems to hit families with addiction is the inconsistency and the lack of reliability of what's happening in the home. So if someone is using substances, how they may behave on the substance versus off the substance can be very, very different. And particularly for children, but spouses as well, you don't know who is there. You don't know who is going to be there when you get home. Is that person going to be intoxicated? Is that person going to be violent? Is that person going to be angry, irritable, asleep, unavailable, as you say? And that there's consistency that's necessary for development, for us to be able to feel safe in a home. And when that is disrupted, which substances do, that could have a tremendous impact on families. So if someone or someone that they love is really suffering from substance use disorders, what are the first steps that they could take to help this person or to help themselves?
Yeah. So I think one of the first steps they need to do is help themselves, and to try to talk to a professional, somebody with some experience with substance use. It could be a self-help program. It could be groups like Al-Anon or AA or NA, and go to a meeting and learn about substance use yourself, and learn about what helps, why people use substances, and what one can do to intervene, and also to help a person stop. So that's, I think, the first step is self-care.
Right. Let's define what some of these organizations are, because everyone may not be familiar. So people may have heard about AA, but let's discuss that a little bit, as well as Al-Anon. I don't know that everyone may be familiar with that organization.
So AA, Alcoholics Anonymous, was started in the 1930s by 2 individuals, Dr. Bob and Bill Wilson, who had alcohol problems and found that there was just no place in healthcare for them. That they were stigmatized, they were not treated seriously. So they came up with the idea of forming a fellowship of self-help, so that people with addictions, people who were afflicted, who was originally with alcohol, could help each other and support each other. And they set up a 12-step program, different steps that one goes through to advance from being powerless and prisoner of alcohol to being free and recovery from alcohol. And so that organization has, thrived. It was started in the United States, but it's really become worldwide at this point. And there have been offshoots of that. There's Narcotics Anonymous, which uses the same 12-step philosophy, but just applied to drugs rather than alcohol. And Al-Anon is alcohol is for families. Is for families, friends, or interested others who really want to try to help somebody who's struggling with the addiction, and to learn to help themselves and get support from other people in the same situation, and also to learn about how to potentially help their friend, partner, a family member who is suffering with addiction. There are other organizations that also involve self-help. There's one called Rational Recovery. The AANA Al-Anon posits a higher power, whatever that is. Could be God, could be spiritual, but there's a spiritual component in that. Some people don't like the spiritual component. And so Rational Recovery is another organization that evolved that uses very much the same principles of self-help, but without the spirituality.
Right.
And there also are faith-based organizations and many resources out there to help people with addictions.
And they're all free.
Yes.
They're all free. You can find out about a meeting online. It's all very easy to sort of find a meeting, and they're multiple times during the day. And very easy to locate.
I wish our healthcare system was like that.
Right.
Where you could go anytime. You can find in Rhode Island. You can find a meeting at almost any time, anywhere. And if you can't get there, someone will pick you up.
Right.
Probably they'll pick you up and drive you to and from the meeting.
Right.
That doesn't happen in our hospitals as much.
It's true.
So they really the organizations really. Can help people. On the other hand, not everybody finds AA or other those groups helpful, but it's part of the menu of treatment that's out there that people could. And I always recommend that people go to an AA meeting. In fact, as part of our training, we as residents we
It's true.
we went to AA meetings and saw how it worked.
Yeah.
This would be exactly my next question. It's how important do you think that those organizations are for our patients? Like in your experience, those years of experience in practice, how much do you think that those organizations have helped our patients?
I think they've helped a lot of people. So there was a big study, national study on alcohol use disorder called Project Match that was done. And Part Brown was one of the sites for that national study. And they found a very interesting kind of matching effect that Alcoholics Anonymous and the idea of what they call 12-step facilitation therapy was most useful for people who didn't have a social network that was supportive of sobriety. Because AA is supportive of sobriety. And many people find that they are surrounded by their friends or coworkers or sometimes a partner, a spouse or a partner who is actively using substances. And it's very hard to quit in that situation when you're constantly around the substance and maybe even offered the substance. You could just have one. Come on. You can, your coworkers say, come on, let's go for a beer after work or something. And it's very hard. And AA is a place where someone can go and socialize and get emotional support from individuals struggling with addiction, but who are supportive of their own sobriety and the sobriety of everybody in the group. And so it's most helpful for those individuals. But I think many people find it helpful even if they're taking medications, they're involved in evidence-based psychotherapy. It's part of the... Listen, addictions are really hard to treat. Many people don't come into treatment for years. They've been using substances for years and years. It's a habit. It's ingrained in their lives, and they don't know how to cope without it. And so they have to kind of relearn how to manage life again. And so it takes every tool we have in the toolbox to really help people avoid substances.
And you mentioned spirituality as one of the components of those treatments offered by those institutions. And we know that spirituality is a protective factor, for example, for suicide. Mm-hmm. How do you see, what is the role of spirituality in the treatment for addiction?
Well, the role is, for some people, it's very important. It depends on the person's interest in spirituality. But for people who accept the spirituality and accept the kind of higher power, I mean, some people will say, God does not want me to drink, so I won't, something like that, and that's sufficient. Or it helps people, I think, understand the ineffable, that thinks that, why do I drink? Why am I so powerless? Why am I, and it sometimes gives people hope that, religion helps people at very difficult times in their lives, gives them support, gives them a reason for being, a reason for going on. And it can help for someone struggling with addiction who feels like, what's the use? I'm always going to be an addict, or it can give them hope. It can. Just to mention, there is interest in psychedelic drugs as which induce a spiritual state, psilocybin, LSD, things like that, and were used traditionally in the 1950s actually to treat addictions, and somewhat successfully, and then they became illegal. But actually, Bill Wilson actually was treated with a hallucinogen called scopolamine in New Jersey hospital, and tells a story of having a hallucinogenic experience, being in a storm, being bashed and everything. And he realized if he could stand his ground in this storm, he could defeat his drinking. And he did. And, for him, that experience of knowing that he could prevail gave him the hope and the determination to stop, in his case, stop drinking, and he went on to full. And so there are some early experiments now using hallucinogen-guided psychotherapy.
Right.
In fact, there's a study that's going to go on at Brown in a little while to begin to explore that and to see, does it really work? Does it really enhance people's, many people find after taking a psychedelic agent, they are much more spiritual.
Interesting.
It opens up that part of the brain that is more conducive to spirituality. I'm not advocating people do this. These treatments are done under very controlled, guided, by licensed therapists. Even Bill Wilson, when he had it, it was done in a medical setting, and it should be. But the idea that maybe we can help people by inducing a spiritual experience for them, and that can assist with their treatment is an idea that's being tested. So there are some new treatments that are out there that people are beginning to explore to make treatment even better. And they're Schedule I substances, and it has to be done with approval of the DEA and the FDA and a whole bunch of federal agencies, and done very carefully. So, one should not just take hallucinogens. But the idea of an induced spirituality.
It's interesting, yeah.
It's interesting.
So what would you say to someone who's struggling with addiction but is anxious about getting treatment, whether there's a stigma or something else going on for them?
Many people are hesitant about getting treatment. It's scary. They may have never done that before. They've never been in treatment. They may have heard some horror stories from other people who've been addicted, and it's illegal. Sometimes people were treated in prisons, so people may have had may hear variable things. So it's common that people will be anxious about it. So I think it's important to really lay out what the treatment is going to be, to have to really talk about this is what's necessary. This is what I this is what I recommend. This is what I feel is necessary. Because ultimately, it's usually that it has to be a partnership, and you have to say, this is what I recommend. I recommend you, let's say, go inpatient for a detoxification. I don't think you can stop using yourself. They have a patient, say, who's been using a lot of opiates, and they just haven't been able to stop because they get these terrible withdrawal symptoms, and they go out and use street drugs, and even when they know they shouldn't, but they can't help themselves. Yeah. So we really talk about what the steps would be to recovery, and give somebody say this is step one, but it's part of a whole process, and give them a sense of what the process is going to be. That first you'll go inpatient for a few days, have a detoxification, then maybe go to a residential treatment program for a period of time to help be in a safe place and help get the substance out of your body for 30 days or so, and then come back and have intensive outpatient treatment. But it depends on the severity of their substance use, other psychiatric comorbidities or medical comorbidities too. So it really has to be individualized. But communication is really important, and there has to be some trust. You can't say, well, I'm going to do this, and then you send the police and send them. Unless it's a severe psychiatric emergency or a person is, but but aside from that, you really needs to be a partnership, and it can be very frustrating. And many medical professionals, it's one of the reasons for stigma, is they see people coming in with substance use problems who don't want treatment. Or who come in seeking treatment, and then the next morning when they sober up, they leave.
Right.
Yeah. And it's very frustrating for a healthcare professional who is, trying to help people, and they perceive these individuals as rejecting help, and they really aren't. It's the addiction.
Right.
Yeah.
It's the substance use that's in a sense rejecting the help.
It's true.
So you had mentioned detoxification inpatient. When is that indicated? Because we know that some substances are dangerous to stop just kind of on your own with no supervision.
Okay. The sedative medications are probably the most dangerous, and that includes alcohol, because at high doses, alcohol is a sedative. So because when the brain adapts to the presence of the sedative by developing excitation that balances the sedation, and then you take away the sedative medication, the brain is still in this excited, activated state and unbalanced, and that can cause epileptic seizures, and really cause all sorts of physiological dysregulations. Stimulation of the autonomic nervous system with a rapid heart rate, high blood pressure, et cetera. So those situations can be harmful for individuals. So in those cases, a medically supervised detoxification is certainly indicated. And then even in a number of other folks, other situations, if the person is really unable to stop use because of other situations, like another psychiatric disorder or maybe a medical disorder, the person has a very severe pain And when one withdraws, so somebody's using opiates illicitly, maybe they started using prescription opiates, but they went to add in illegal opiates as well. And if they stop using it, they'll have the withdrawal symptoms, and but in addition, their pain will rebound and get much, much worse. And that will keep them from being unable to not use opiates. And so having them in a supervised medical setting until they go through the withdrawal might be helpful. So if the person's unable to stop using drugs in an outpatient situation, then the inpatient would be indicated. Sometimes it actually also depends on a person's insurance, and whether the insurance company will pay for it as well.
Yeah, because there are some substances that, unfortunately some insurance companies say, well, sorry, that one's not a substance that causes a life-threatening detox. And so they'll say, sorry, no inpatient detox in that situation.
Right. But but sometimes they will drive a person to the street, and then they might, as we talked about, use an adulterated drug. And,
for sure.
And that could be life-threatening.
That could be life-threatening, yeah.
So it's sometimes very important to put some people in a setting that's supervised, so they really can get over the effects of the substance.
There are a lot of mental health conditions that have always, historically and presently, although I'm hoping less presently, have a connection to not only what we think medically needs to happen, but societal norms, societal pressures. We've been talking about stigma and bias. And so your comment before about how AA was started, there was nothing for people, they weren't really welcomed into the medical profession. It's important for us to acknowledge that we haven't always been welcoming to folks who have addiction because we don't know exactly how to treat it as well. And now that there's a process that has occurred where addiction is now seen as a disease, has helped people shape their view of the person coming in for the 5th, 6th, 7th time to seek treatment as part of the process, as opposed to being angry at the person for coming in. And we've also had a lot of bias of how we've diagnosed which disorder. And there's also been a tremendous amount of bias in the legal system of who gets incarcerated for use and who doesn't, and what drug gets longer terms in treatment, longer terms in incarcerations versus others. And some of those are equilibrating out now that we're having these frank discussions about how the legal system, society, and medicine sort of interface with addiction, an area that we have to take a look at because it is very prominent in our society. And here we are in a place where we have cannabis that is available in some states, and also looking at some very potent medications that have been used in the past, LSD, ketamine, to be used medically. So we have to be very careful in acknowledging our own biases in medicine along the way, and also having people in the community know that people with addiction have a disease. Right. It's a disease. It needs treatment, and there are treatment options available. And it's not something that can be incarcerated out of them like any other disease. That's not a treatment for a disease, but there are treatments that are available. So I just wanted to, make sure we acknowledge our role as in medicine, that we weren't always as present and vocal support, and that we need to be. We need to speak up and say, what does the data show? And focus on that, because that's our training.
Yeah. Well, I think you bring up some social issues, and I think there are two issues with addiction that are due to social social issues. First of all, I think there is, we have in general a mental health crisis where there's just not enough capacity. There's more need for mental health services than the medical establishment can provide. Certain areas are acute. Child mental health is particularly crisis mode, but addiction is also. So there's a lot of people. We started off this discussion talking about, the very few people who have substance use disorders actually get treatment.
Right.
It's a small number, and part of that is we don't have the capacity. There aren't enough addiction facilities. There aren't enough addiction professionals to provide that treatment. Some programs have, some states, Rhode Island is particularly enlightened in providing treatment services for incarcerated individuals. And people get incarcerated because drug use is illegal.
Right.
And it's amazing that if one gets caught with a bunch of Xanax that, is, and you don't have a prescription for it, it's a felony. And that can mess up the rest of your life, having a felony conviction, and continue the cycle of incarceration. But Rhode Island is a state that provides detoxification and treatment inside the walls, as they say, and also treatment as transition when people leave treatment. The Veterans Administration has good programs. Every VA has a Veterans Justice Outreach Coordinator who works, or several sometimes, who works, and these individuals are usually social workers who work as liaisons with the court system to help get people in treatment and help arrange the transition to when people leave, so that they're less likely to offend. So that's one kind of at-risk population that we're beginning to take care of, recognizing that they're a group of vulnerable individuals who need extra services.
Right.
And we need to do a lot more of that.
Right. Yeah, I agree with that. So let's say that one of our listeners is out there and they're trying to determine whether they have a problem with substance use. What signs should they look for in themselves to indicate that they might fall under someone with a substance use disorder or a problematic pattern of substance use?
Yeah. So looking at the diagnostic criteria, but kind of making them easy to, does one using substances to excess?
Okay.
Using. Now the problem is that's relative, and what if all your friends are substance users?
Exactly.
A person could say, I'm not using any more than my friend George here, who, he uses more than I do. But if one looks at if you get hints from people, a spouse or somebody's telling you, maybe you need to cut down on your drinking, or they get annoyed when you're intoxicated using the substance, that should be a red flag that, maybe something's wrong. The second thing is that the loss of control, that you can't stop. Can you not drink or drug for a week?
Right.
We've talked about, I think in the popular press, people are doing sober Januaries because they're often more consumption of substances prior to the holidays or during the holidays. So people want to do sober or sober October. I think that's another month that is decided. And could you go without using your substance for an entire month? And if you can't, you might have a problem there. And if you can't do it for a week or even 3 days without using your substance, maybe you've lost control over that substance use. So it's a way to kind of self-test. Set up a test for yourself. Say, I'm not going to use cannabis for a week, or, and just try not to use it.
Right.
And see what happens. And, certainly if one develops a withdrawal symptom, that's also evidence that, that that you can't. Some withdrawals are, as we talked about with Jared, that some withdrawals are mild. So for nicotine withdrawal, most people go through nicotine withdrawal, although there are ways of helping people with nicotine replacement and other medications. And if you do think you have a problem, talk to your doctor. Or you think you might have a problem, talk to a healthcare professional or somebody who knows something about addictions.
Right.
It could be your clergyman or clergywoman. Talk with them about, what do they think?
Right.
So thank you very much, Dr. Swift. It's a pleasure to have you here. This
My
was
pleasure.
extremely helpful. Thank you. Now a take-home message to bear in mind.
So we've been talking about substance use disorders and how it affects millions of people. And many people don't know they have a problem with their use, but have significant dysfunction in their lives socially, economically, legally, physically, or professionally. Warning signs include using drugs under dangerous conditions like driving, needing to use more of the drug to achieve the same effect, and continuing to use despite negative consequences in your life. Recovery is possible and common. And an important step in the route to recovery is to seek treatment. Do not let the stigma stop you from getting help for it. There is safe, effective, and evidence-based treatment available.
So if you're concerned about a substance use problem, the Substance Abuse and Mental Health Administration has a free confidential 24-hour treatment referral and an information service at 1-800-662-HELP or 1-800-662-4357. You can also find treatment online at findtreatment.gov. Also, if you or someone you know is emotionally overwhelmed or having unsafe thoughts, please get in touch with the Suicide and Crisis Lifeline. Call or text 988 or access 988lifeline.org.
Thank you for listening to our podcast. For more information related content, please check out our Instagram, Facebook, and YouTube channel. Bear in mind the Brown Psychiatry Podcast. Thank you.
Thank you.